Hello friends, welcome back to my YouTube channel. In this video lecture, we will be covering the solution to the ESIC 2019 Pharmacist exam question paper. This is part 2 of our series. So, if you missed part 1, be sure to check it out. The link is right in the description below. Don't forget to like, share and subscribe if you find this helpful. Let's get started. Question number 44. Respiratory distress syndrome is premature infant is caused by the absence of option A myoinositol, option B lecithin, option C cephalin, option D phosphatidylserine. Correct answer is option B lecithin. Myoinositol is a nutrient that helps cells function and stay healthy. It is a component of the vitamin B complex and is found in the plants and animals. And lecithin is a mixture of fats that are initial to cell in the human body. It can be found in food including soybean and egg yolk. In the diet, lecithin is the main source of choline, a nutrient similar to the B vitamin, and lecithin is converted into acetylcholine, a substance that transmits nerve impulses. Respiratory distress syndrome (RDS) in premature infant is caused by the deficiency of lecithin, a substance that acts as a surfactant in the lungs. Here is the explanation. Lecithin, also known as the dipalmityl lecithin, is a surfactant that coats the inside of the lungs and prevents the alveoli from coalescing. Premature infants are more likely to have RDS because their lungs are not able to produce enough to their substance. Next question. Which of the following is a quinolone containing urinary tract anti-infective agent? Option A enoxacin, option B siloxacin, option C nalidixic acid and option D ciprofloxacin. Correct answer is option C nalidixic acid. Nalidixic acid is a quinolone antibiotic used to treat urinary tract infection, and siloxacin was the oldest synthetic antimicrobial related to the quinolone class of antibiotic with activity similar to oxalic acid and salicylic acid. It was commonly used 30 years ago to treat urinary tract infection in adult, and ciprofloxacin is an antibiotic agent in the fluoroquinolone class used to treat bacterial infection and urinary tract infection. And enoxacin is a second generation fluoroquinolone and similar properties to norfloxacin and lomefloxacin. Next question. Trench fever is a option A bacterial disease, option B viral disease, option C protozoal disease, option D rickettsial disease. Trench fever is a bacterial infection that was previously considered as a rickettsial disease. Correct answer is option A. Trench fever is caused by the bacterial infection caused by the bacterium Bartonella quintina and transmitted by the human body louse. And symptoms of the include fever, headache, muscles and joint pain and rashes. Next question. Hydrogen peroxide assay is performed by option A diazotization titration, option B neutralization titration, option C redox titrations, option D non-aqueous titration. Correct answer is option C redox titration. The hydrogen peroxide assay is performed by redox titration. Redox titration is used to determine the concentration of hydrogen peroxide in a solution by measuring how much of a reducing agent it reacts with. This method is effective because hydrogen peroxide is a strong oxidizing agent. And hydrogen peroxide is a chemical compound that is used in many products including bleaching agent, disinfectant and sanitizer. It is powerful oxidant that can kill bacteria, virus, fungi, yeast and spores. However, hydrogen peroxide breaks down easily in the presence of light and heat or a metallic catalytes, so its concentration need to be checked regularly. Next question. Which of the following is a superficial vein of the cardiovascular system? Option A, subclavian vein. Option B, axillary vein. Option C, basilica vein. Option D, palmar vein. Correct answer is option C. The basilic, encephalic and median subcutaneous veins are the superficial vein in the cardiovascular system. Basicular vein, usually largest superficial vein in the arm, it runs along the medial side of the arm and is often used for the dialysis axis. Encephalic veins run along the biceps and is known as the signature veins. And median cubital veins often used to draw blood. And palmar vein is a network of the veins in the hand that carry deoxygenated blood from the finger and palm to the heart and lungs. And axillary vein is the large blood vessels that carries blood from the upper limbs and upper chest wall of the heart. And subclavian veins is a large paired veins that carry oxygenated depleted blood from the upper body back to the heart. Next question. Which of the following is not a waste product of protein metabolism? Option A, ammonia. Option B, creatinine. Option C, urea. Option D, uric acid. Correct answer is option B, creatinine. Creatine is not a waste product of protein metabolism. Creatine is a waste product produced by the muscles from the breakdown of creatine. It results of the normal wear and tear of the muscles. The kidney filter creatine from the blood and release it into the urine. Urea and ammonia are the waste product of the protein metabolism. Ammonia, a waste product produced when the bacteria in the intestine digest protein. The liver process ammonia into urea, another waste product. Uric acid. Uric acid is a waste product produced from the breakdown of ammonia acid. Next question. In the presence of food, absorption of drugs such as ampicillin, option A, increase. Option B, first reduce and then increase. Option C, first increase and then reduce. And option D, reduce. Correct answer is option D. In the presence of food, absorption of drugs such as ampicillin is reduced. Next question. Adiposide is a semi-synthetic derivative of option A, plant alkaloid, option B, plant glycosides, option C, plant tannin, option D, plant terpenes. Correct answer is option B, plant glycoside. Adiposide is a medication used in the treatment of cancer like bladder, stomach and lung cancer. Next question. The heteroatom present in phenothiazine are option A, oxygen and sulfur, option B, sulfur and nitrogen, option C, oxygen and nitrogen, option D, nitrogen and nitrogen. Correct answer is option B, sulfur and nitrogen. The heteroatom present in the phenothiazine are sulfur and nitrogen. The phenothiazine is an organic compound with a tricyclic structure that consists of two benzene rings fused of a center thiazine ring. The term heteroatom refers to an atom in a molecules that are not carbon or hydrogen. Phenothiazine are a class of heterocyclic compound that are used in the manufacturing of dyes and pigments. They are also used in pharmaceutical and found in many biological active molecules. Next question. Which of the following is not a cell-derived mediator for inflammation? Option A, acidic lipid. Option B, vasoactive amine. Option C, lymphokines. Option D, kinin. Correct answer is option D. Next question. Standard for surgical dressing are given in option A, Schedule F2, option B, Schedule H, option C, Schedule F3, option D, Schedule FF. Correct answer is option A, Schedule F2. The standard for surgical dressing are given in Schedule F2 of Drug and Cosmetic Act and Rule in India. Here are some other schedules and their standards. Schedule F1, standard for vaccine, antisera and diagnostic antigens. And Schedule F3, standard for umbilical tapes. And Schedule FF, standard for ophthalmic preparation including solutions and suspension. And Schedule A, contains letter for licensing applications. And Schedule B, fee structure for government run labs. And Schedule C, biological product and their regulation. And Schedule D, list of drug exempted from imports. Schedule E, contains poisons and their regulation. Schedule G, list of drug that can be sold without a prescription. And Schedule K, contains veterinary drugs. In Alzheimer's disease, which peptide level is elevated? Option A, beta amyloid. Option B, beta alanine. Option C, alpha hemoglobin. Option D, alpha amino adipate. Correct answer is option A. Alzheimer's disease is a brain disorder that gradually destroys memory and thinking skill and eventually in the ability to perform even simple tasks. It is most common type of dementia in older adult. Next question. The intake of minimum of 4 to 10 drugs at the same time on the regular therapeutic basis is called option A, drug overuse, option B, polypharmacy, option C, drug abuse, option D, drug overdose. Correct answer is option B, polypharmacy. The intake of minimum of 4 to 10 drugs at the same time at regular therapeutic basis is called polypharmacy. It is common practice in managing multiple or chronic health conditions, especially among older adults. Next question. Hormones are isomeric with option A, coumarins, option B, quinolines, option C, iodols, option D, pyrimidines. Correct answer is option A. Marasmus is associated with option A, protein and carbohydrate deficiency, option B, fat and carbohydrate deficiency, option C, only protein deficiency, option D, fat and protein deficiency. Correct answer is option C, only protein deficiency. Marasmus means protein energy undernutrients, a severe form of malnutrition. It is caused by the lack of calories and deficiency of all the macronutrients. Marasmus is a severe form of the malnutrition. These result that from an overall lack of the calories, it deficiency of the all macronutrients, which means the body lacks the fuels it needs to maintain normal functions. People suffering from the marasmus shows the symptoms are weakness, dry skin, poor muscle development, irritability, and slow growth rate and weight gain. Next question. An integral membrane glycoprotein of the human RBC is option A, chitin, option B, glycogen, option C, glycopharin, option D, amylopectin. Correct answer is option C. Glycopharin is an integral membrane glycoprotein found in the human red blood cells. Functions. Glycopharin is help maintain the stability and function of RBC membrane. It also carries sugar molecules and rich in the salicylic acids, which gives RBC hydrophilic charge coat. The coating allows RBC to circulate without sticking of the other cells or vessels wall. Next question. Valerenone is the active constituent present in option A cinchona, option B jatamansi, option C myrobalan, option D calamig. Correct answer is option B jatamansi. Next question. Synovial cell is joint is an example of option A basophil, option B macrophage, option C neutrophils, option D lymphocytes. Correct answer is option B macrophages. Synovial cells is joints are example of macrophages. Macrophages are type of white blood cells that are found in the lining layer of synovial tissue and play a key role in the maintaining the synovial fluids that lubricants and nourish the cartilage in joints. Macrophages are included spherical shaped bacterial are termed as option A bacillus, option B spirochetes, option C vibrio, option D cocci. Correct answer is option B spirochetes. Spherical or oid-shaped bacteria are called the cocci. The word coccus comes from the Greek word coccus, which means berry. And here are some other common bacterial shapes: Bacillus, Spirillum, Spirochetes, and Vibrio. Vibrio is a quaternary ammonium compound that is used as detergent in option A Savlon, option B chloroxylenol, option C caramide, option D chlorhexidine. Correct answer is option C. Caramide is a type of fat molecule found in the cell membrane and nerve covers. Next question. The natural alkaloid used in the treatment of gout, option A colchicine, option B aspirin, option C amidine, option D none of the above. Correct answer is option A colchicine. Colchicine is used to prevent or treat of gout, and this is also called the gout arthritis. This condition is caused by too much uric acid in the blood, and gout occur when uric acid causes inflammation, pain, redness, swelling and heat in a joint. Next question. Acid fatness in acid fast staining is due to the abundance of option A mycolic acid, option B peptide glycone, option C ergosterol, option D squalane. Correct answer is option A. Next question. Acid fastness is a acid fast staining is due to the abundance of the mycolic acid in the cell wall of the bacteria. Explanation. Mycolic acid is a waxy substance that makes the cell wall impermeable to the most stains except for those used in acid fast staining. The acid links with substance within the cell wall of the bacteria, making them resistant to dechlorization with acid alcohol treatment. Pilocarpines is an alkaloid containing option A oxazole, option B pyrrozole, option C imidazole, option D pyrrole. Correct answer is option C imidazole. Pilocarpine is an alkaloid that contain imidazole, and pilocarpine is a muscarinic agent agonist used to treat dry mouth and various ophthalmic conditions. Next question. A pharmacy professional should be option A non-approachable, option B incapable of lateral thinking, option C observant, option D unavailable. A pharmacy professional should not be unapproachable and unavailable, but should be instead of observant and capable of lateral thinking. Next question. The orthotoledine test is performed for assessing the effectiveness of option A, water purification, option B, chlorinations, option C, sewage treatment, option D, organic purification. Correct answer is option B, chlorinations. The orthotoledine test is performed to assess the effectiveness of chlorinations by measuring the residual chlorine level in water. Next question. Which of the following can be marketed under generic name? Option A, analgin. Option A, glutathione. Option B, analgin. Option C, barbital. Option D, mepromate. Correct answer is option B, analgin. Analgin, also known as a metronidazole, is a prescription or drug belonging to non-steroid anti-inflammatory drug. It prescribed for reducing pain, inflammation and fever. Generic name used to treatment of pain and inflammation. It's also helpful to alleviate the fever. Next question. The specific test for identifying imidazole rings in amino acid is option A, Millen test, option B, poly test, option C, Purette test, option D, Folin test. Correct answer is option B, poly test. Poly test is a biochemical test for the detection of tyrosine and histidine. Poly test is specific test for identifications imidazole ring in the amino acid. It is a biochemical test that used to reagent to couple with imidazole group amines and phenols. The test is particularly used to detect histidine and amino acids that contain an imidazole ring. Deficiency in the activity of sphingomyelinases enzyme leads to option A, Jacob disease, option B, Krabbe disease, option C, Kocher disease, option D, Niemann-Pick disease. Correct answer is option D. Next question. An increase in the size of an organ or tissue that is not associated with the cancer is termed as option A, dysplasia, option B, neoplasia, option C, hyperplasia, option D, metaplasia. Correct answer is option C, hyperplasia. Hyperplasia is an abnormal increase in the number of cells in a tissue or organ. The cells appears normal under a microscope. Hyperplasia can be caused by the pathologic, and pathologic hyperplasia can be sign of the abnormal and precancerous change. Next question. The art of planning, organizing, staffing, motivating and controlling is called option A, advertising skill, option B, manufacturing, option C, management, option D, marketing. Correct answer is option C, management. The art of planning, organization, staffing, motivating, controlling is called management. Planning, organization, staffing. Planning is a manager think ahead their action based on the method, plan and logic. Organization, manager coordinate the organization, human and material resources. Staffing, a basic management function. Motivating, manager direct and motivate subordinate. And controlling, manager ensure that the plan or norms are not derivative form. Next question. When the anesthetic is injected in the subarachnoid space, it is termed as option A, surface anesthesia, option B, infiltration anesthesia, option C, spinal anesthesia, option D, epidural anesthesia. Correct answer is option C, spinal anesthesia. Next question. Spinal anesthesia, also known as spinal block, is a procedure that numbs a part of the body using a local anesthetic or opioids injected into the subarachnoid space. The percentage change in quantity caused by 1% in price is known as option A, income elasticity of demands, option B, price elasticity of demand, option C, inelasticity of demand, option D, cross price elasticity. Correct answer is option B. Next question. A sulfur containing amino acid is option A G-glutamine, option B orthionine, option C alanine, option D asparagine. Correct answer is option C. Alanine is a sulfur containing compound found in the garlic that is derivative from the amino acid cysteine. It is natural constituent of the fresh garlic and is precursor of the thiosulfinate, which are responsible for the pungent flavor of the garlic. Sulfur containing amino acid is cysteine and methionine. Next question. The condition of weight loss and muscle atrophy is severe. Chronic illness is called option A cachexia, option B rickettsia, option C porphyria, option C pyrexia. Correct answer is option A cachexia. Cachexia is a condition that causes weight loss and muscle atrophy in people with severe chronic illness. It is known as the fasting syndrome or anorexia cachexia syndrome. Next question. Hemostasis forceps, of also known as option A ordinary forceps, option B artery forceps, option C swap holding forceps, option D Myonian forceps. Correct answer is option B artery forceps. Hemostatic forceps, also known as the artery forceps. They are also called hemostats or the hemostatic clamps. Hemostatic forceps are surgical instruments used to control bleeding during medical, veterinary and laboratory process. They are used to clamp blood vessels, tissue or other small structure of minimize blood flow. And hemostatic forceps have ring handles similar to scissors and ratchet handles and allow to the forceps to be secured in different position and pressure. There are different models of artery forceps with specialized using such as micro mosquito artery forceps, clay artery forceps, Kocher artery forceps and pin artery forceps. Next question. The price that equates market supply and market demand is called option A market clearing price, option B market elastic price, option C market depreciating price, option D market restoring price. Correct answer is option A market clearing price. The price that equates market supply and market demand is called market clearing price. Next question. The conference board is the organization for compiling the index of option A aggregate indicator, option B macroeconomic indicator, option C market indicator, option D leading indicator. Correct answer is option D leading indicator. Schedule S refer to option A the standard for disinfectant fluids, and option B the standard biological and special product, option C the standard for patent and proprietary medicines, option D the standard for cosmetic. Schedule S refer to, correct answer is option D the standard for cosmetic. This is Schedule S of the Drug and Cosmetic Rule 1945 refers to the standard for cosmetic. Other schedules are Schedule O standard for disinfectant fluids, Schedule P life period of drug, Schedule P1 packaging of drug, Schedule Q list of dyes, colored pigments allowed in cosmetics and soaps, and Schedule A list of model form of the license, Schedule B fees for test or analysis at the center drug laboratory or state government analytic, and Schedule C list of biological product with special import, sale, distribution, manufacturing, Schedule C1 list of other special product with special import, sale, distribution, manufacturing provisions. Next question. Thomson disease is associated with, correct answer is option D muscular dystrophy. And Thomson disease, also known as a myasthenia congestia, is a rare genetic disorder that causes muscle stiffness and delayed muscle relaxation. Next question. Glucocorticoids are involved in option A, fat metabolism, option B, sodium metabolism, option C, fluid balance, option D, potassium metabolism. Correct answer is option A, fat metabolism. Glucocorticoids are involved in the fat metabolism. Next question. The committee formed in hospital setting that is responsible for the overall pharmaceutical care is termed by WHO as option A, DIC, option B, PTC, option C, DTC, option D, DIF. Correct answer is option C, DTC, the Drug and Therapeutic Committee. The committee formed is a hospital setting is responsible for overall pharmaceutical care is termed as by WHO as the Drug and Therapeutic Committee, DTC. Next question. Is a non-peptide hormone produced by the posterior pituitary gland. Option A, aldosterone, option B, prolactin, option C, vasopressin, option D, thyroxine. Correct answer is option C. The pituitary gland produces different hormone in two lobes. One is anterior lobes and second is posterior lobes. Anterior pituitary produce hormones are growth hormone, prolactin, FSH, follicle stimulating hormone, and LH and ACTH and TSH, thyroid stimulating hormone, and posterior pituitary, vasopressin and oxytocin. And aldosterone, the steroid hormone secreted by the adrenal cortex, promote retention of sodium and excretion of potassium by the kidneys. Next question. Thyroxine, also known as a T4 hormone, produced by the thyroid gland that regulate metabolism and help control growth and development. Next question is, the study of arthropods of medicinal importance is termed as option A, medical herbology, option B, medical entomology, option C, medical ornithology, option D, medical hepatology. Correct answer is option B, medical entomology. Next question. A drug that promotes diuresis by antagonizes the action of aldosterone is option A, furosemide, option B, acetazolamide, option C, spironolactone, option D, vimetanidine. Correct answer is option C, spironolactone. Spironolactone is a class of medication called aldosterone receptor antagonist. It causes the kidney to eliminate unneeded water and sodium from the body into the urine but reduce the loss of potassium from the body. And furosemide is a loop diuretic, and acetazolamide belongs to a class of drug known as the carbonic anhydrase inhibitor. It works by the decreasing the production of fluids inside the eye. It is also used to decrease a build up the body fluid edema caused by the heart failure or other or contains medications. Butonides is a diuretic medications. Next question. Who among the following is referred to as the father of Indian pharmacy? Option A, Asima Chatterjee, option B, Har Gobind Khurana, option C, Ramnath Chopra, option D, Mahadeva Lal Skof. Correct answer is option D, Professor Mahadeva Lal Skof, properly known as the father of pharmacy education in India. And Ramnath Chopra is the father of Indian pharmacology. And Har Gobind Khurana, the chemist who cracked DNA code and made the first artificial gene, is known as the father of artificial genetics. Next question is, the capacity of drug to cause fetal abnormality is termed as option A, tetragenicity, option B, pathogenicity, option C, carcinogenicity, option D, mutagenicity. Correct answer is option A, tetragenicity. Some example of tetragenic drug include is thalidomide, a drug that can cause defect in a developing fetus, and AC inhibitor, angiotensin converting enzyme inhibitor, can cause this problem in the fetus if taken in the third and second trimester. And statins should ideally be stopped at least 3 months before conception. Next question. The nutrients antioxidant present in Indian gooseberry is option A ellagic acid, option B catecharic acid, option C alpha lipoic acid, option D aspartic acid. Correct answer is option A ellagic acid. Ellagic acid is a natural polyphenol compound that is found in fruits, vegetables, nuts and wines. It has a biological property including antioxidant and anti-inflammatory effect. Next question. The pharmaceutical price regulation scheme is exercised to have option A indirect control over generic price, option B direct control over generic price, option C indirect control over branded price, option D direct control over branded price. Correct answer is option C indirect control over branded price. Next question. An amino acid considered as a lipotrophic factor is option A methionine, option B tryptophan, option C serine, option D histidine. Correct answer is option A. Methionine is an initial amino acid that plays a key role in the transportation and metabolism of fat in the liver. It helps prevent fat from accumulation in the liver by the adding in the removal of lipids. Other lipophotic factors are folic acid, vitamin B12, beta-alanine. Next question. mRNA is synthesized in the nucleus as option A hnRNA, option B scRNA, option C tmRNA, option D snRNA. Correct answer is option A hnRNA. mRNA is synthesized in the nucleus as a heterogeneous nucleus RNA. Which following is a macrolide antibiotic? Option A neomycin, option B erythromycin, option C streptomycin, option D kanamycin. Correct answer is option B erythromycin. Erythromycin, claromycin and azithromycin are all the macrolide antibiotic. Erythromycin is commonly used to treat infection like pneumonia, and aminoglycoside include gentamicin, amikacin, and neomycin and streptomycin and tobramycin. And aminoglycosides are the polar drug with poor gastrointestinal absorption, so intravenous or intramuscular administration is needed. They are excreted randomly. Next question. Structural evaluations of patient medication for improving health outcome is termed as option A medication error, option B pharmacovigilance, option C hospital formulary, option D medication review. Correct answer is option D medication review. Structural evaluation of a patient medication for improving health outcome is termed as a medication review. Next question. Phyloquinone is another name for option A vitamin E, option B vitamin A, option C vitamin K, option D vitamin D. Correct answer is option C vitamin K. Vitamin A is retinol, vitamin B1 is thiamine, vitamin B2 is riboflavin, vitamin B3 is niacin, B5 is pantothenic acid, B6 is pyridoxine, B7 is biotin, B9 is folic acid. B12 is cyanocobalamin, vitamin C is ascorbic acid, vitamin D is calciferol, vitamin E is tocopherol, vitamin K is phyloquinone. Next question. Which of the following is an H2 receptor antagonist? Option A cimetidine, option B proxylifine, option C cyclizine, option D loperamide. Correct answer is option A. Cimetidine is a gastric acid reducer used in the short-term treatment of duodenal and gastric ulcer. H2 receptor antagonist, also known as H2 blocker. and class of drug that reduce the amount of stomach acid production by blocking histamine H2 receptor in the stomach. Used to treat a number of conditions, heartburn and gastroesophageal reflux and gastric ulcer, duodenal ulcer. Next question is the active metabolite of impramine is correct answer is option D, desipramine. Active drug, and these are active. Which of the following is called milk of magnesia? Option A, magnesium oxide. Option B, magnesium sulfate. Option C, magnesium hydroxide. Option D, magnesium chloride. Correct answer is option C, magnesium hydroxide. Milk of magnesia, also known as magnesium hydroxide, has many properties include chemical formula is MgOH2, molecular mass is 58.31 gram per moles, and appearance is white odor solid, and melting point is approx 350 degrees Celsius. Solubility not very soluble in water. Next question.